Hello, my name is Victoria Nampito, and I'm a certified nursing assistant. And in this video, I will be demonstrating how to properly wash your hands, how to how to apply different forms of oxygen therapy, and how to perform a 24-hour urine sample, how to strain urine, and how to collect a midstream urine specimen, and finally, how to perform range of motion on an upper extremity. Right, Patrick McGee? Patrick says right. So let's get started! Yay! Yay! Say bye-bye! Say bye-bye! Okay, so the procedure for washing your hands. First things first, you're going to want to turn on the sink and begin wetting your hands all over on your back, the back of your hands, your palms, and also a few inches above your wrist. And once you have a good lather, you're going to want to get some soap and do like 2 or 3 pumps of soap so that you have a good, some good suds there. And you're going to want to soap up your hands and your wrists as best as you can for about 30 seconds or longer. And so once you have a good amount of soap, you're making bubbles and everything's going well, you're going to now rinse off your hands for another 30 seconds or longer. Make sure you get rid of all the soap suds. And while you're doing this, you also want to make sure that you don't touch any part of the sink, because that would be recontaminating yourself. And also don't lean up against the sink so that you're not contaminating your uniform. And once all the soap is gone and you've rinsed for a good amount of time, you're going to go get some paper towels and dry off your hands, and then throw away those paper towels and grab another 2 paper towels to turn off the handles of the sink. It's important to do that with a paper towel, because if you don't, then you recontaminate your hands. And that's it. Hello, my name is Victoria, and I am a certified nursing assistant, and today I will be demonstrating how to apply different forms of oxygen therapy. So, for starters, I will knock. Hello, Billy Rubin. My name is Victoria, and I am a CNA. Today, I am going to be giving you some oxygen to help you breathe a little bit, okay? He says okay. He gives me consent. Okay. So I'm going to check and make sure that this is Billy Rubin, and lo and behold, it is. Good thing. Okay. So the first thing I am going to put on you, Mr. Rubin, is a nasal cannula. Okay. So a nasal cannula, in case you wanted to know, is it has prongs, so it goes up your nostril, okay? Nostrils, you have 2. And it loops around your ears like so. So let me demonstrate for you. So it goes up here, just like that, and then it goes around the ears here, like so. And it fastens at your neck so that it stays there. Now, some common issues with a nasal cannula is that, like, there's irritation around the cheekbones because it's sitting on their face all day. So, to make sure that Billy Rubin is feeling the best that he is feeling, we're going to make sure that there is no irritation, and we're going to clean his nose every 2 hours. Okay, so this nasal cannula will be attached at the flow meter at 2 to 6 liters. And if Billy Rubin is having any issues with excessive drying, we could even attach the nasal cannula to a humidifier. And what happens with this is when the oxygen passes over the humidifier, it picks up some water molecules, and then it helps moisturize the nose. And so in the case that bilirubin does have a humidifier, you got to make sure it's always bubbling. Because if it's not always bubbling, then we have some problems, and you got to go tell the nurse. Okay. Is that okay, bilirubin? Does that feel comfortable? Okay. So how about we try something different? We're going to try a Venturi mask. Venti mask. Yeah. So this is the Venturi mask, okay? And it comes with, oh boy, I'll pick that up. It comes with several different colors of adapters. Do you see that? Yeah. So he's informed, he knows. So the significance of these adapters is that it gives you the different percentages of oxygen that it's going to allow through. So,
Mr. Rand, can you call 376? Mr. Rand, 376.
So this attaches to Mr. Rubin's face, just like a regular non-rebreather. So, Mr. Rubin, I'm just going to put this here, okay? And we're going to wrap this around, and unfortunately the strap doesn't work. And I can't fix it, so we'll try it. But, oh, we're going to like...
Good afternoon. The American Studies is meeting in the RC. American Studies is meeting in the RC.
We're just going to let that go there. Okay, so you attach this to the flow meter at the desired amount, depending on the color-coded adapter. And then you must document how much oxygen is being delivered, depending on the colored adapter. Okay, so how are you feeling, bilirubin? He's feeling great. Okay, so we're going to try something else, okay? I'm just going to take this off of your face. Now, I'm going to try, we're going to try the partial non-rebreather, okay? So the difference between a partial and the complete non-rebreather that I had on his face earlier, or no, I didn't do that one yet. Just kidding. I didn't have it on his face earlier. This one has holes on the side that aren't being covered, so he is still rebreathing a portion of his CO2. So I'm gonna put this on your face here, okay, Mr. Rubin, and this is gonna go around your head to secure it in place. All right. Does that feel okay? Okay, so you can fasten them by pulling on the strings here. And this has a bag attached to it as well. And with the bag, must inflate with oxygen. That's how you know that the oxygen is flowing through it freely. And he's actually getting the oxygen. So if it's not filled, then you have to tell the nurse because something's wrong. Okay. Are you feeling good, Mr. Rubin? He's feeling great. All right. So let's move on to the next. So this was the partial. Okay. This is the complete non-rebreather. This one is different from the partial. Partial has holes. This one's being covered. See? Yeah. Okay. So I'm going to show Mr. Rubin here so that he's informed. So, Mr. Rubin, I'm just going to put this around your face, okay? And like before, you can fasten the strings here so that it's tighter and fits better to his face. This one is attached to the flow meter at 15 liters as well. And just like with the partial, you have to make sure that the bag fills with oxygen, because if it does not, then the oxygen is not flowing freely and there's a problem. And in the case that you find the bag deflated, you have to tell the nurse. Okay, so are you feeling okay, Mr. Rubin? Okay, do you have any questions about the complete non-rebreather? He says no. Okay, so we're gonna take this one off of you and we're gonna try our last one, which is called the simple face mask. With the simple face mask, it doesn't have a bag, you see? But it does have the holes, just like in the partial non-rebreather. So this one is kind of similar to the nasal cannula, and it is catered towards our patients that are mouth breathers. So if Mr. Rubin here had his mouth open a lot, which he does, and he breathes from his mouth more commonly, then we would put a simple mask on him because a nasal cannula wouldn't help him very much. So I'm going to put this on his face like so, okay? Okay, Mr. Rubin, and we're going to bring this around your head. And this has a nose clip, so I can make it tighter around his nose. Does that feel comfortable? He says yes. And we can tighten the straps here, just like before. Okay. Now you attach this to the flow meter at 2 to 6 liters, just like the nasal cannula. And you can go up to 8 if it has the humidifier. So if Mr. Rubin here is having a lot of irritation, then we can attach to a humidifier just like the nasal cannula. And yeah, so that is everything for the different forms of oxygen therapy. You feeling okay, Mr. Rubin? Yeah? Okay. Well, I'm going to take this one off. And before I go, do you need anything else? He says no. Are you comfortable? Let me make sure you're feeling comfortable. Okay. I think you look pretty comfortable if you had to ask me. I'm going to lower your bed, make sure it's in the, oh, it already is in the lowest position. And if this is the position you want to be in, then you're okay. We give you your call bell. Okay. And just use this if you need anything at all, okay? Okay, goodbye. Okay, I'm going to demonstrate how to collect a 24-hour urine sample. Okay, so first things first, a 24-hour urine sample is used to check on kidney function and urinary output. So for a patient or resident on 24-hour urine, they have to have a notice outside their room that says that they're on 24-hour urine, so that everybody knows, and so that like nobody takes them to the bathroom and one of their voidings is not recorded in the 24-hour jug. So some things that may be used for somebody on 24-hour urine: definitely a 24-hour jug. This jug is where all of the voidings during the 24-hour period will go into. This jug holds 3,000 cc's of urine, and on this jug you have to write the date and the time that the 24-hour urine sample started. Okay, and this jug can be put on ice to help prevent the spread of microbes if they want. This is a hat. It has a graduate on the inside. This hat is used to collect a urine sample, so this may be used as a form of a place where somebody could void into, and then from here it would go into the 24-hour urine jug. So this is just one form of voiding devices. Okay, this is a urinal. It's calibrated on the inside, just like the hat. I mean, on the outside, just like the hat, so that you can measure how much urine is in here. This is used for male residents or patients. And again, they can void into this, and then this is transferred into the 24-hour urine jug. Okay. We also have a bedpan. This is used, it goes underneath their bottom so that they can urinate or void into this. And then this is then transferred into the 24-hour jug. Similarly, this is a fracture pan. This pan is used for those with hip issues or a hip fracture, and they void into here, and then that is transferred into the 24-hour jug. Okay. And then you could also use a commode, and in the commode, they void into the commode, then you take the bucket and you put it into the 24-hour jug. Okay, so this is a regular graduated cylinder. If the patient is on I's and O's, then you have to measure like how much each voiding was. So every time they voided, you would instead transfer from bedpan, urinal, whatever it is, into the graduated cylinder, measure how much urine is being voided, and then transfer that into the 24-hour jug and document the time and how much was voided. It's important that during all these voidings, no toilet paper touches the urine. If it does, you have to restart. No BM touches the urine. If it does, you have to restart. Or nothing is spilled or accidentally missed when you're transferring from bedpan to graduated cylinder to 24-hour jug, or from bedpan to 24-hour jug. Yeah. And also, I just lost my train of thought. Oh yeah, the first urination has to be discarded, and that marks your starting point for the 24-hour check. Okay. Good morning, Taylor. My name is Victoria, and I'll be your CNA today. How are you?
Good.
That's good. Okay, I'm gonna check your ID bracelet, and you are indeed Taylor. So,
We're gonna do 2 clips. I'm gonna
you
check
said
in, his name.
you had your call bell on. You have to go to the bathroom?
Yes, please.
Yeah. Okay. All right. So I'm going to gather my materials, and we'll get you going. My materials are a towel to cover the bedpan. A washcloth so that she can wash her hands. Some toilet paper so that she's nice and clean after. And then the bedpan. Okay, so I'm going to get some gloves on. Okay. I'm going to raise the bed up. So do you have any plans for today?
No.
No, you're not gonna go play bingo or anything?
No, that's for like really, really old people. I'm just old.
Yeah. I knew that.
It's boring if you're not old.
Right. Right. It's reasonable. Okay. This is good. Alrighty. So, now, I'm gonna get the bedpan out. So I'm gonna roll you on 3, okay? Grab the side rail. Okay, 1, 2, 3. I'm gonna put this underneath here, and then you can roll back, okay? Does that feel okay?
It doesn't
Okay,
stay in.
good.
Punch in the
All right, so I'm gonna cover you up.
pounding it. Oh, it doesn't
What-
stay in.
Yeah.
I'm just gonna crop this part out.
Yeah.
We're just gonna rest.
Okay, I'm gonna sit. I'm gonna sit your.
We're just gonna
sit
rest.
you up a little bit. Okay. Do you feel okay? Do you
Yeah.
like this position?
Perfect.
Yeah. Okay. Are you comfortable on there?
Yep.
Okay. Good. Okay. Here's your call bell.
Thank you.
You make sure that when you're finished, you use that. And here you can have some toilet paper to wipe yourself.
Under the depends.
Do you need anything else before I go?
Nope.
Okay. I'm gonna lower the bed bow all the way down. Okay. Alrighty, use your call bell when you're finished, okay? Hi Taylor, are you all set?
Yes.
Okay. Alrighty, you feeling better now?
Yes. Much better. Relieved.
Okay. I'm glad. I'm glad. Okay, so I'm gonna reach over you. I'm gonna raise your bed up, okay?
You put me in the ground yet. What the heck?
You're right. You aren't dead yet. Okay. So you watch any good movies recently?
Yeah, I had my grandchildren come over and we watched The Line Sense together. It was the best thing ever.
Nice.
Haven't watched that in decades.
Yeah.
I mean, they're getting older, so.
Lauren's the height of the bed. They're getting older. How many grandchildren do you have?
10.
10, really?
Shit, girl.
And how old are all they? I'm gonna uncover you, okay?
Okay. The youngest is 2, the oldest is 20.
Wow.
I'm just gonna say.
What are their names?
Amelia, George, Hank, Jim.
Okay.
Yeah, that's all I remember. My dementia is kicking in.
Yeah, I'm sure. Okay, reach over, and I'm gonna roll you on 3, okay?
Yep.
1, 2, 3. Okay. I'm gonna grab this out from underneath you, okay? And you can turn back on 3, all right?
Yep.
1, 2, 3. Okay. You feeling okay?
Yep.
All right. So I'm gonna cover this. Cover the bedpan. Like so. Okay. And then before I go, I'm gonna recover you. Like this. Okay. Oh, wait. Do you want to wash your hands?
Yeah.
Yeah, here you go. Wash your hands. Would you like the head of the bed up?
Yes, please. Just a little, though.
Just a little? Okay, let me know when to stop.
That's good.
Okay. And I'm going to lower this all the way.
Wait. Shut.
Okay.
You should lower
Are you
the
done
bed.
washing your hands?
Yeah.
Yeah. Okay, do you need anything else before
We're
I
gonna
go?
pretend there's still water in this
No.
bucket.
All right. Here's your call bell.
Thank you.
If you need it, you can. Are you going?
Go.
Okay. So now I'm going to bring the bedpan over. Hold on. I'm going to put the washcloth that she used to wash her hands into the linen cart. So I'm going to walk over here. So once I make it to the bathroom, I'm going to uncover the bedpan. And I can discard of this in the linen cart. I pretend this is the linen cart temporarily. Okay. And then I would pour over a commode, but if I spill any, then I have to restart the whole thing. So I'm not going to spill anything. So I'm going to pour this over the commode, making sure the bedpan doesn't touch the graduated cylinder. And then, because Taylor is on I&O, I would record her output once I measured this. And then from this, I would then transfer this, her contents in here, into this, and this jug should have her name and the date and time that I started the 24-hour urine test. And her room and the bathroom should also be marked stating that she is on 24-hour urine, to be tested. Okay, so now I'm going to demonstrate how to collect a midstream urine specimen. Okay, so first, you're going to have the person void into a voiding device that I stated earlier, so either a hat, a bedpan, a fracture pan, a urinal, or a commode. And as they are voiding, you're going to take a urine sample cup, which should have their name and information and lab stuff on it, and you're gonna go. They're gonna start voiding. You're gonna go under, and you're going to fill this 120 cc's or 4 ounces. And then once that is full, before they finish voiding, you're gonna take the cup out. You're gonna put the cap on. Okay. And then you're going to clean their peri area. So the way you need to clean their peri area is using a towelette, like one of these. And you're going to wipe their peri area 3 times, okay? So once that is done, you're going to assist them with hand washing, and then give them their call bell, make sure they're comfortable, and you're going to take your urine sample and ooh, I almost dropped that. And you're going to take the 2 vacuum tubes here, and you're going to attach like this, and it's going to vacuum seal it up into both of these. And this has sediment at the bottom for lab purposes. So you're going to do that to both of those, and then you're going to put this into the biohazard bag with the requisition slip and send it to the lab. And that is how to collect a UA-CNS. Now I'm going to demonstrate how to strain urine. So you strain urine when there's a possibility of somebody having crystals or stones in their urine. So basically you have the patient void into a voiding device such as a hat, a urinal, a bedpan, a fracture pan, or a commode, just as I stated earlier. And then you pour the contents into a graduated cylinder with the strainer on top. So when you're pouring, so let's say they voided into a urinal, you're going to have them, you're going to pour whatever's in the urine in this into this, make sure that they don't touch. And then if there are any stones or anything, it will be collected in the strainer and it won't go into the urine. So then you can document how much urine was voided, and you can put the urine contents into a specimen container and put the stones or crystals or whatever you find into the biohazard bag with the requisition slip and send it to the lab. Good morning, Lily. My name's Victoria. I'll be your certified nursing assistant. How are you today? Okay, that's good. Let me just double check and make sure that you are. Wait, I need to find Lily. Okay. And you had your call light on. Do you have to go to the bathroom? Yeah. All right. So I'm gonna raise the bed up. Ooh.
So you should start with one on this one. So you start with one on this one.
Okay. How was breakfast? Was it good?
So then you take
That's
this
good.
off.
All right.
Here. And then you
That's
put
good
this
enough.
plug
I'm gonna lower the side rails on my side
and then when you take
and
it
get
off,
some gloves on. And when you take it, alrighty.
you want to
Now we're
clamp
going
it
to
with your
fan
pinky
fold
and
his
your ring
sheets
finger
down.
and then pull out. Yep,
And
then
I'm
pull
going
out.
to
Yep.
uncover him and give him the urinal and make sure that the penis
Only
does
if you
not
touch
touch
anything to
the
show that you
urinal.
don't have to do it.
Okay, so just because it won't stay otherwise, it has to touch. And I'm going to cover him back up, provide for privacy with the curtain, and I'm going to lower the bed down.
Taylor, you guys have a bedpan? For like admitting person, you guys have a bedpan?
Okay, I'm going to raise the side rail. Here's your call bell. Make sure you use it once you're finished, okay? And here's some toilet paper to use once you're done. Okay. Okay, his call light goes on. Hello, Willie. Wait. I'm going to remove the urinal now, okay? So he's finished. Cap this. Cover him back up. Oh. Yeah. And then I'm going to cover him. Do you need anything else before I go? No? Alright. Here's your call bell. Use it if you need anything. Go. Oh. Okay. So I would be in the bathroom, but after you give your resident the urinal, you're going to strain his urine. So what I would do, I would have gloves on, PPE, and you uncap this, okay, and then pour this in here with the strainer on top. This is the graduated cylinder. Okay, so you're gonna pour the contents in the urinal into the graduated cylinder with the strainer on top to make sure that they don't touch for contamination purposes. Okay. All right, so then after I do that, I would measure his output, document that, and then I would send the urine. I would put the urine into a specimen container, send that to the lab, and put the crystals or whatever was strained out of the urine into a container as well, and send that with the urine specimen container and the requisition slip to the lab. Okay. Good morning, Taylor. My name's Victoria. I'll be your CNA. How are you today?
Good. How
That's
about you?
good. I'm great. Thank you for asking. All right, so I'm just going to double check and make sure that you are Taylor, and you are Taylor. So today, we're going to do some range of motion exercises on your arm, okay? All right. So, first thing, I'm going to lay your control fell. I'm going to lay the head of your bed down so that you're flat, okay?
Sounds good.
Okay, that's good. Alrighty. So, this one. So we're gonna exercise your shoulder, your elbow, your forearm, your wrist, and your fingers, okay? All right, so the first exercise we're going to do, we're just gonna move your arm up and down like this, okay? This is called flexing and extending. All right? Okay. So, before we do that, we should raise the bed for good back mechanics.
You're too young to hurt your back.
I know, that's why I've got to raise the bed so that I don't hurt my back. You know? I'm going to provide for privacy by putting the curtain around, but because this is already tied up, I don't want to like untie it. So, okay, so we're going to start with your shoulder exercises. So I'm going to hold your arm here and underneath here, okay? And we're going to go up and down 5 times. Okay? Ready? 1, 2. Let me know if you have any pain or discomfort, okay? 3, 4, 5. How does that feel? Does that feel okay?
Feels like a workout.
Yeah?
Yeah.
Okay. We'll try and make it quick then. Okay. All right, so next we're going to go out and in, okay? So like this. And this is called abducting and adducting, okay? All right. So we're going to do this 5 times. And again, let me know if you have any pain.
Will do.
1, 2, 3, 4, 5. All right. Is that feeling okay?
Yes.
All right. You're gonna bend your arm like this. Okay. And just go up and down like a robot. We're gonna do that 5 times. 1, 2, 3, 4, 5. How you feeling? Feeling okay?
Yes.
All right. So now we're going to exercise your elbow. So we're going to flex and extend like this, like we're lifting weights.
Okay.
Okay. So we're going to do this 5 times, okay?
Yep.
1, 2, 3, 4, 5. Feeling okay still?
Yep.
All right, so now we're going to exercise your forearm and we're going to flip it onto its back like this. Do that 5 times.
Okay.
Okay, this is called supination and pronation, all right? Okay. So, 1, 2, 3, 4, 5. So now we're going to exercise your wrist. We're just going to start with flex and extend, so like this.
Okay.
Okay? So we're going to do this 5 times. And again, let me know if you have any pain. 1, 2, 3, 4, 5.
Okay, I'm doing this. Sarah, you do anything? Can you start holding those sheets to help you?
All right, so now we're going to do side to side, okay? So, 1, 2,
Just put it there and then we'll put it back. Are you
3,
sure?
4, 5. So now we're going to do your fingers, okay? So we're gonna go out and in like this with your fingers, okay? So 1, 2, 3, 4, 5. Okay, and then we're gonna go up and down like this, okay? So up, and then curl your fingers in. 1,
Haley, are you sleeping?
2,
I think it's on that one.
3, 4, 5. All right, and then we're gonna touch each finger to your thumb, okay? And we're gonna do that 5 times. All right, so 1, 2, 3, Okay. All right. How are you feeling? How are you feeling after we did that exercise?
I feel much more mobility.
All right, that's good. Okay, so I'm just gonna lower your bed. Do you want the TV on or anything?
Yes, please.
Okay, I'll turn the TV on.
Thank
And
you.
do you want the head of your bed up?
Nope, I'm good.
Okay.
I snoozed through most of my TV.
Yeah. Okay. And do you need anything else before I go?
Nope.
Are you comfortable?
Yes, ma'am.
Okay, well here's your call bell if you need absolutely anything at all, all right?
Thank you.
All right, thank you.